Well, we're very thankful, as I know these two have an extremely busy schedule. And Dr. May, as well as Gary Mays from the Sullivan County Health Department, have agreed to take a little bit of time tonight to address the board, address the citizens of Kingsport. Once they're finished, we'll do our best to allow you all to ask them some questions. If they struggle to hear you, I'll relay the question. And Mike is going to turn his laptop over towards the podium so that you'll be able to see them speak as they come up here. So, Gary, Dr. May, thank you for coming, and I'll turn the podium over to you all.
Okay. Thank you, Mr. Mayor, for the opportunity, and thank you, Alderman, for allowing us to attend. I wish it could be under better circumstances. I know you've asked us here to talk about COVID-19. And before Dr. May joins me here at the podium, I just would like to say that during this crisis, I've seen unbelievable cooperation between all of our governments in Sullivan County, Bristol and Bluff City and Sullivan County governments, the mayors and city managers, Chris and Bill Sora from Bristol. We've been meeting frequently, many times at the health department, talking about issues, trying to solve problems, and understand what the public needs would be in terms of public health and managing crisis. We're also meeting with all of our school systems, our 3 public school systems, and we have discussions with our 2 private school systems in Sullivan County, and all have been extremely cooperative. And our public safety community has been engaged, volunteer and professional, police, fire, and EMS, and many other agencies, our highway department, our public works department, from the city of Kingsport and Bristol. So it has truly been a community effort, and people really coming together for the public good. And I just really can't compliment Kingsport Alderman, the mayor, representation, and all the city departments that we work with, working together, and feel very confident about what we've been able to accomplish so far. Our team at Sullivan County Health Department is very busy, and they have been working around the clock. I want to take an opportunity to say that we have a line available to the public that is staffed from 7:30 until 6, and we have RNs staffing those lines. They're very capable of taking the public's call. Our number is 279-2777. Also, the state of Tennessee Department of Health has opened up an 800 line. You can reference their website at Tennessee Department of Health. And so, again, staffed with professionals to take calls. And so we want information to the public as much as possible, and factual and pertinent, because we believe our health department's role is to provide that. So without further ado, I'm going to ask Dr. May to join me at the podium, because I know the Board of Mayor and Aldermen would like to ask us a few questions. So we'll dedicate the rest of our time to that, if that's okay, Mayor.
That's fine. Board, so it's hard to get everybody at once. So let me just go down the line here and see what questions you have. I'll start with Vice Mayor George. Colette, would you like to ask a question?
Gary, right now it looks like we have 2 confirmed cases in Sullivan County, and both of those have been quarantined. Are they both getting better at this point? And are you doing as much testing now, or is that already tapered off a little bit?
The first part of your question, we believe our first case is could probably be categorized as recovered, and the patient did well and was very cooperative. Second patient is cooperating with us, and so is being closely monitored. And that, you're correct that we have only 2 confirmed cases in Sullivan County, but honestly we expect that number to rise. Testing is not tapered off. We continue to test. Ballot Health System continues to test. ETSU continues to test. Dr. May is ordering tests, and so as more tests are being conducted, obviously we will have more cases. But also, we will have more cases, and we are preparing for community spread and hoping that we do not. Did I answer your question?
Yes, sir.
Okay.
Colette, do you need a follow-up question?
I'll let everybody else ask.
Okay, I'll come back around if anybody wants to ask again. Alderman.
Gary, let me ask you, where are you, the locations located that everyone's going to be tested? I know there's a call-in number, but do you have just a random place where people could go if they have some of the symptoms that they may think they have? Could they go be tested?
Well, currently, we don't do random or asymptomatic or folks that do not present with the symptoms testing. They can call our line, and our nurses can ask important questions to see if that person needs to be tested. Also, Ballot Health System on their website has identified testing locations, but they're going through the same process with screening, and that is the process that we have for testing in Tennessee currently. We hope as equipment and supplies arrive, we would be hopeful, and we are prepared to do that on a much broader scale, but right now it's only for a limited scope. And Dr. May, I'll invite him to comment on that.
Right. We have multiple sites that are set up through Ballot, but we do send everybody through a pre-screening process. That does a couple of things. One, we're allowed to fill out the forms, the lab requisitions, and collect the data that we need to track disease before the person even gets there. Then working with Ballot, we coordinate with when they have supplies, when they have their drive-thrus open, when they have their clinics open. We're able to coordinate the receiving the patient and collecting their specimen and facilitating which lab that test should go to. And depending on whether they're high risk or not, sometimes determines the lab. We know some labs are slower, some labs are faster. We can get a lab through the Tennessee Department of Health usually within 24 to 48 hours, certainly if it's a critical healthcare worker.
Any other questions, Tom?
No, it's.
Okay. Alderman Cooper, would you like to ask questions?
Sure. We're bombarded during this time with information, and so besides washing your hands and social distancing, what else would you recommend that we do to keep our community as safe as possible during this time?
Well, this is a great question, and I know the public has heard social distancing and washing hands, and to the point they probably don't want to hear it anymore, but truly that is our key strategy and key countermeasure to this disease, is staying 6 feet away from folks, washing your hands purposely, mechanically correctly, with soap and water, and don't travel out of the Tri-Cities area if you don't need to. And I know that's easier said than done, but all of our cases in Sullivan County that we've had so far are related to out of Tri-Cities area travel. And I understand completely, we need to travel, we need to see family and friends, but this is not the time. If we can delay those travels, and if we can maintain social distancing and slow down the spread, we just do not want to overwhelm our hospital system. And you don't have to watch TV 10 minutes and see all these horrible stories of hospitals in New York City, California, Washington State, not to mention Italy, and see what devastation that has on our population once you get spread. So this is a key message, and something we must implore upon our public is those 3 measures are very effective to minimize the spread of this disease. Thank you.
Ms. Cooper, do you have a follow-up?
Right now, thank you.
Okay, well, let me follow up to Betsy, to Dr. May. Dr. May, everybody talks about flattening the curve. Could you talk a little bit about that? medically, but simple enough so we can understand.
Yeah, yes, sir. When we talk about flattening the curve, normally when we see a new disease move through a naive population, we see a rapid exponential curve that rapidly moves through the population. Well, we know we have a certain capacity within our hospital system, and if we can flatten that curve, now you still wind up with the same number of cases, but over a longer period of time. And that allows our hospital system an opportunity to respond. To put this into perspective, we know that 5% of patients are going to need some type of high-level or critical care or ventilator. We can do the math. We have 155,000 constituents in the county of Sullivan, and if you'll do the math, you're talking thousands of people that's going to need critical care beds, ventilators, and supportive care. If we can spread that 5,000 over 3, maybe 4 months, it may be tolerable. But if you look on any given day, all of our intensive care units stay pretty well full. Our ventilators remain on a marginal status as far as extra ventilators. And as such, when we get a large influx of patients that actually needs that therapy, without it, they will die. If we can manage the influx into the healthcare system, then at least we have the opportunity to try to give that patient the best outcome that is available.
Thank you. Alderman Adler. Jennifer?
Thank you for joining. Yeah, thank you for joining us and providing such good information. A lot of the questions I had in mind have already been asked. The one I wanted to ask about was, I feel like increasing questions and concerns over the safety of doing things like going to the grocery store or pumping gas, and things that need to continue to go on. But could you speak to what we know about in terms of like how long a virus can live on surfaces and what we can do in terms of shopping safely for groceries, pumping gas, all those sorts of things?
Okay, there's a lot of literature and research going on in this area. We do know that this virus can survive for a significant time, 2 to 3 days, on hard, inanimate surfaces. Non-porous surfaces, not quite so long. However, you still have to continue on living. So first, the social distancing. Second of all, wash your hands before you go. Wash your hands, or gel in, gel out is what I call it, when you come out of the store. Try to keep your the handles that you're touching, or use an obstacle to keep you separated from touching inanimate objects. But it really comes down to, one, the social distancing, maintaining that 6-foot distance, and then continuously keeping those hands washed and avoiding touching your eyes and face. Those 2 measures right there will actually stop the spread if you're out in public, keeping that 6-foot distance, and then being sure you wash your hands before you go in, as you come out, and those are the basic measures that you need to do. It's not rocket science.
Do you have a follow-up question, Jennifer? No follow-up?
Nope. Thank you so much, though.
Okay. Alderman Duncan? Daryl?
Yeah, I've got a couple of questions, I guess, for Dr. May. One, our president today came out and said that he thought everything would kind of be back to normal, that's paraphrasing, by Easter, and that seems much different from anything that I've seen or read so far. Could you kind of comment on that? And then I've got one other question I'll ask too.
That remains a challenge. This is a story that's being written as we live our lives. We don't have what it's going to do for this summer. We really don't know what the prognosis is going to be for going into next fall. We do know from history, looking at pandemic flu of 1918, there were actually 3 separate waves that went through. So predicting what's going to happen with this bug is very uncertain. We do know, though, that if we can slow the spread, it buys us time. And that critical time is what we need to develop therapeutics that we can use, so antivirals that can be used against this virus in supportive patient care, and also buys the time for development of a vaccine. Looking at where other parts of the country are and seeing that our numbers are somewhat mirroring what has happened in other sections of the country, I can only predict that I think we will get worse before we get better. That timeline remains uncertain. It's got to do also with our level of social distancing and how effective are we at slowing or flattening that curve.
And your other question?
There's one follow-up too. So when we hit that curve and we come down, are there a chance of like a revirus, if that's really a term, but a chance of another type peak?
That is absolutely certain. That could happen in that we've looked at other countries, looking at Hong Kong. They relaxed a lot of their measures actually a little early, and now they are seeing a second peak or second wave starting to go through Hong Kong. They had great measures in place, did a great job with it, actually had decreased numbers of what should have been expected, but with opening the borders, reopening the businesses, they are now seeing a second wave proceed through that population. So that may be a lesson that we'll need to learn from in the future.
You good, Daryl?
Yes, thank you.
Alderman Phillips?
Yeah, thanks for being here. I just had one question, maybe a follow-up. How many people in Sullivan County a day are getting tested right now, and do we have are we okay on being able to test? I mean, are we not backed up like you hear on the national news of other major cities being?
At the present time, we've not run into limits of not being able to test, particularly working with our partner of Ballad and working with the Tennessee Department of Health. However, we are not doing open testing on anybody who wishes to walk up and have a test. First of all, that becomes a wasted test, because if you're asymptomatic and feeling well, almost all patients will have a negative viral screen, but they may be positive next week. So we're really trying to focus on those who have symptoms, and that we need to discern, are you acutely ill? And then we can place those isolation measures in place in an effort to prevent further spread. But at this time, we have adequate capacity for what we have been screening.
And just my follow-up to that is then, is there any reason or real explanation for why I think Tennessee earlier today had 667 cases and Virginia only had 290? Is there a real reason why we're so much higher than our neighboring state?
That's a challenging question to answer, but we know that we now have community spread, community infection and transmission within two areas of the state, particularly the Nashville, Davidson area. Franklin has had widespread community transmission, which exponentially causes growth of the number of cases that we will see. The other factor is the delay that we've had in implementing a lot of our social distancing measures. We're just coming off a spring break. A lot of kids are coming back into the area, and all of our cases in the Northeast region have been pretty much tied to travel or a household contact. So that makes it even more important that we focus on this social distancing concept, but even more advanced social distancing to include the decrease of travel and people interacting with each other on a daily basis.
Okay, I got another question. Do we have any way of predicting how it will affect our healthcare workforce? I mean, because they're the ones that are right on the front lines.
Yeah, it's a great question and a concern. So, what Ballard Health Systems and most all of our public safety agencies in Sullivan County, city and county, are doing screening at the beginning of shifts for personnel and asking the same questions basically that we ask for the screening for the test, and that is to prevent somebody from coming into work and spreading that among critical care work or critical workers, such as your hospital workers, your law enforcement, your public safety agencies, sanitation and waste. Very important measure, and I applaud the cities and county for really being aggressive in that.
Are there any other questions from y'all out there?
I have one. I said,
Go ahead, Betsy.
we're testing the people that show symptoms. What percent of those are positive? I mean, are the majority, since we're looking for only testing the ones that present with the symptom, are the majority of those positive? What's the percent?
Okay, if you're looking at asymptomatic children, we know that 4% will be asymptomatic altogether. 96% of children will show some type of symptom, be that fever, cough, shortness of breath. In adults, we're still learning a lot of these studies. Most of the tests that we have done here in Tennessee have actually been negative. Even though we have 667 cases, there's been a large number that we've tested that have been negative. So does that answer your question? There is asymptomatic carriage that has been identified, and thus when we do our contact tracing, we drop back 2 days before they become ill to track down all those people that they may have exposed, and those people we place into quarantine for 14 days to be sure that they don't become ill.
Tommy, go ahead.
You mentioned that we could be short on ventilators and things like that. Are we making plans to receive more? And another thing, in clothing for nursing and other staff members, such as the mask and the protector, the eye protector, and the gowns that they wear, are we in good shape there? And this is just a question that I'm particularly interested in.
Well, it's a question that we are interested in as well, and to a very high degree. Are we in good shape now in terms of personal protective equipment? Yes, but we do not have ongoing community spread, and we don't look like some of the areas of the United States, and we're trying to prevent that. But every day we are resourcing, looking for resources for personal protective equipment. The federal government has released a national stockpile of medical supplies, and that is a pre-planning process that we've had in place. In fact, there's another truckload coming in today that is to support our EMS, healthcare, pre-hospital healthcare workers in our healthcare system, or first responders. And so we are very concerned about that, and that's why we are trying to be diligent. That's one of the reasons we're here tonight, is to deliver the message. There's a lot of unknowns about this disease, as Dr. May has articulated very well, I think. But what we do know is that social distancing, washing your hands, staying at home unless you need something important such as medicine or food, stay at home and minimize the spread. Let's not look like New York City or Washington, and Lord forbid, Italy. And it could happen. Our population is prone. We're susceptible to this disease. So work with us. I know it's very difficult, but I applaud the Board of Mayor and Aldermen for inviting us here. I can't emphatically say that any clearer, but I appreciate the question.
Any other board members have another question?
Yeah, I do. In terms of when you talk about this disease should affect 5% of our population, and to the effect of needing ventilators. When we look at the flu and the effect the flu has on this size of community, what percentage will need the care just with the flu?
Well, to give you a relative comparative number, we know that flu every year has a death rate of 0.1%. We're looking at a death rate with this of 3% on average. We know that 80% of people will do fine and not need any type of medical care. We know 15% of people will need to enter the healthcare system and need some type of supportive care. And then those 5% that are the sickest will need the highest level of care. And you say, well, 5% is not very much, but it is when you start looking at a large population of people versus the number of intensive care unit beds, ventilators, and support care centers that we have in the entire region. Flu is 0.1% as opposed to 3%. So that's the comparison number that you need to keep in mind.
Any other?
Ask about an upsurge if we let down, but also when you talked about that, I don't know is this something that people can recatch? I mean, like if I have the flu, then I'm good for this year, I'm not going to have it again. Have there been strands of this? Or, I mean, he was talking about if we let our guard down, then we didn't get it, we may get it, but if people have already recovered, are you through with this, or is this something that could come back and re-affect people?
We know that there is short-term immunity that develops, but the long-term immunity studies are still pending. We don't know. This is just way too new of a virus.
Any other questions, board? Mr. City Manager, do you have questions for our guests?
No, I get the privilege of talking to these guys almost on a daily basis. I just will say you guys are doing a great job. We're very fortunate in Sullivan County to have a strong health department with your all's leadership. I know in talking to other managers across the state, they're very pleased with what they've seen us do very proactively, all of which has been led by your efforts, and so we'll keep up the good fight.
All right.
Well,
Thank you, Mayor, and thank you, Chris, for those kind compliments. And I want to say I've got to thank my team at Sullivan County Regional Health Department, all the employees there. They're logging in long hours, and they're preparing and they're working hard, and I'm very proud of them for all they've done. And thank you for the opportunity to be here.